Welcome to this mini lecture on hip osteoarthritis aimed at medical student level. My name is Khabab Osman and I am one of the registrars on the Birmingham Orthopedic Training Network and part of the Birmingham Orthopedic Network. Osteoarthritis is the most common condition we deal with as orthopedic surgeons. It is defined as degeneration of the joint cartilage and underlying bone and has a range of causes and predisposing factors. It is important to know how to identify and describe osteoarthritis on a radiograph, and there are 4 X-ray features which can be seen in osteoarthritis. The first is loss of the joint space, and this is easily identified when comparing to a normal joint, but even on a single joint, you may see uneven loss of joint space. This is the earliest feature of osteoarthritis, and the remaining features are a result of complete loss of cartilage in some parts of the joint, leading to irritation of the underlying bone. As a result, you get hardening of the underlying bone, causing the appearances of subchondral sclerosis and subsequently the formation of subchondral cysts. As in many parts of the body, bone usually responds to irritation and damage by creating more bone, and this happens at the edges of the articular surfaces and can be seen as osteophytes. The main symptom of osteoarthritis is pain, but stiffness is also a symptom. Typically, the pain of osteoarthritis is worse after activities and therefore worse at the end of the day, and patients can have quite a miserable time during the night after having a long day of activity. Conversely, their stiffness improves with activity, and one of the features that differentiates it from an inflammatory arthropathy is that morning stiffness lasts less than 30 minutes. As the patient becomes more active, their stiffness improves. When you examine a patient with hip osteoarthritis, you will find that they may have an antalgic gait due to pain in the affected side, or they may have a Trendelenburg gait due to weakness of their abductors, which occurs after prolonged stiffness or pain inhibition on the affected side. When you examine their range of motion, the first movement which tends to be affected is internal rotation in the flexed position. Secondly, flexion is affected, and lastly, hip abduction is affected. You may be able to identify a fixed flexion deformity when you perform a Thomas's test, and this is as a result of capsular thickening in the anterior capsule, and sometimes is as a result of posterior osteophytes, which do not allow the hip to extend. The diagnosis of osteoarthritis is a mainly clinical and radiological diagnosis based on the clinical examination and the X-rays. It is of course important to examine the joint above and the joint below, looking for radiation of pain. And if there are any concerns regarding an inflammatory cause for the pain, then blood tests would be warranted. There are various scoring systems which can assess the severity of osteoarthritis clinically, and the Oxford Hip Score is one which is commonly used. The treatment of hip osteoarthritis ranges from conservative to surgical methods. Conservative treatment includes patient education and activity modification. For example, offering the patient a walking stick can give them some symptomatic relief. Also, physiotherapy is useful to encourage their range of motion and build up the muscle strength around the hip joint to avoid exacerbations of pain. Medical treatments, including non-steroidal anti-inflammatory drugs and other painkillers, are used, and steroid injections into the hip joint can give some temporary symptomatic relief. There are a range of surgical interventions available for hip arthritis, depending on the severity and the age of the patient. The most common intervention is a hip replacement, which involves excising the femoral head and replacing the femoral head and acetabular cup, usually with metal and plastic components. Other operations are more rarely done, and these include osteotomies to realign the hip, arthroscopic debridement, sometimes used for younger patients, and excision arthroplasty and arthrodesis, which means hip fusion, are very rarely used.